Welcome, everybody. It's my pleasure to be your moderator for today's session. My name is Mike Blackman, the Director of Long-Term Care for the County of Renfrew, home of Bonnechere Manor, Miramichi Lodge. I'm a registered nurse with over 35 years of experience in long-term care, and I'm honored to participate as a member of the Ottawa Valley Ontario Health Team Steering Committee representing long-term care. Thank you for joining us today as we discuss an innovative approach to seniors care gaining recognition on a national level, Nursing Home Without Walls, enabling older adults to age in place. This webinar is being offered today by the Ottawa Valley Ontario Health Team and its members. The OVOHT is made up of more than 50 local health professionals, healthcare providers, organizations, and community members who are working together to improve our health system and connect patients to the services they need. Ontario Health Teams are a coordinated way of organizing and delivering care that is more connected to patients, families, and caregivers in their local communities. Through Ontario Health Teams, or OHTs, groups of healthcare providers, including hospitals, doctors, and home and community care providers, work together to deliver a full and coordinated system of care for patients. This session today is being provided among a series of webinars before we launch our one-day Aging in Place forum on May 15th. This full-day event will bring together healthcare professionals, service providers, policymakers, decision makers, and community members to work together to create a shared 10-year vision for aging in place across the Ottawa Valley. I'll take this opportunity to perform a land acknowledgement. The Ottawa Valley Ontario Health Team and its partners are located on the traditional, unceded, and unsurrendered territory of the Anishinaabe Algonquin people. We take this time to express our gratitude and respect to these people, and to the land for all that it has provided and it will continue to provide. While we recognize the territorial acknowledgements are only one step in cultivating greater respect for and inclusion of Indigenous peoples, we commit to accompanying these words with actions. We are dedicated to building a future and community that is better for all. We pledge to continue exploring and making meaningful contributions to the Truth and Reconciliation Commission of Canada's call to action. Now I'll dive into introducing today's speakers. First, we have Dr. Suzanne Dupuis-Blanchard. She's a registered nurse and professor at the School of Nursing at Universite de Moncton, where she also holds a research chair in population aging as well as director of the Center on Aging. She has worked with older adults for over 30 years, first as a community health nurse and now as a professor researcher. Her program of research focuses on multiple facets of aging in place, including with older adults living in official language minority communities. Suzanne is recognized for having developed Nursing Home Without Walls, the topic of today's presentation. She has co-chaired the development of the New Brunswick Provincial Strategy on Aging, is past chairperson of the National Seniors Council, and past president of the Canadian Association of Gerontology. Suzanne is also a fellow of the Royal Society of Canada and the Canadian Academy of Nursing. Next, we have with us Stephanie Lagosky. Stephanie is a knowledge translation expert with over a decade of experience translating healthcare knowledge in a variety of settings. Currently, she works as a senior program lead with Healthcare Excellence Canada, where she's responsible for the spread and scale of the Nursing Home Without Walls program across New Brunswick and Canada. Prior to this, she worked in knowledge translation in systematic reviews with Cochrane in Germany, in patient partnership and quality improvement with Health Quality Ontario, Ontario Health, and community-based and women's health research with Women's College Hospital in Toronto. Stephanie holds a Master's of Science degree in Health Professional Education from Western University. And rounding out the itinerary, we have Emma Keech. Emma is a passionate advocate for senior care and community development, bringing over 15 years of experience in recreation, healthcare, and project management. She currently serves as the Senior Research Coordinator at the Charlotte County Seniors Resource Center, operating under Passamaquoddy Lodge in St. Andrews. Recently, Emma was invited to join Regional Committee for Community Development, furthering her engagement in meaningful community initiatives. She also sits on the board of the Passamaquoddy Children's Center. Emma is pursuing her Bachelor of Business Administration at Yorkville University, with graduation expected in December 2025, continuing her long commitment to personal growth and impactful leadership. A bit of housekeeping before we get started. We invite you to add questions to the chat function, which we will monitor and respond to questions at the end of the presentation. And please note that today's session will be recorded. And with that, I will turn it over to our presenters to get us started. Thank you.
Thank you so much, Mike, for that wonderful introduction. And thank you for the invitation as well to yourself and Lisa and the group. We are very pleased, my colleague and I, to be here to be able to discuss Nursing Home Without Walls. It is a program that is currently being offered in New Brunswick and with a national spread about to happen. And so we're happy to be here to be able to discuss in more details and more length about what is Nursing Home Without Walls. And if this is the first time you're hearing about it, know that we will go into some of the explanations in the first few slides. Um, there we go. So, Nursing Home Without Walls is very much about aging in place. The reason and I was pleased to hear that you are on a 10-year, I guess, vision of how to keep older adults living at home. And it is the wave of the future because we know that older adults first want to remain at home. We see that through the work of the National Institute on Aging, that 100% of older adults want to remain at home. And in fact, Statistics Canada shows us or informs us that actually 92% of older adults are actually living in the community and outside of institutions. A lot of people think that it's more than that, that there are more than 8% of older adults in long-term care facilities, but they are not. It is about that 92% that are in the community. And it's rightfully so that we think about aging in place. If we think of population aging, the baby boomers that we hear a lot of talk about, we know that population aging is for the next 30 to 40 years. And there are needs in the community for older adults, and that not everyone will be needing to go into long-term care. And if they do need to go, that we can hopefully keep them in the community a bit longer. And so that is what Aging in Place is trying to do. And Nursing Home Without Walls is one of those programs that is there to support older adults in doing so. So, through research that we've done in the past, my team and I on aging in place, we had been doing research on why older adults could not remain at home for probably a good 10 to 12 years, even before aging in place became popular, if I can say it that way. And what we were hearing from older adults in the community were that certain services they were able to access. And some of those were around housekeeping, around cutting the lawn, snow removal. So a bit of home maintenance, I guess. And that those service providers were mostly family members and also paid services. And when we were talking to them about aging in place or doing surveys with them, many said that there were services missing as well. And some of those services that were mentioned were the following. So people were looking to receive meals or help with meals or with doing groceries. Also looking for social contacts. Aging in place should not mean that you are aging in isolation or being lonely. And so, some of the things that we were hearing was that older adults very much wanted some social contacts and some outings as well. That transportation was a need and was difficult to access. Information on programs and services and activities. Many did not know of the services that do exist. And so in research, they would tell us there are no services at all for aging in place. And that the application process, if they were services, the application process was so complicated that they would oftentimes not go through with the application itself. We heard a lot also about outdoor maintenance, and it was one thing to have your lawn cut or the snow removed, but what about the plants and painting the fence and the snow removal of the steps or in front of the garage door? And those were things that was a bit of I guess it seems like it's extra or not important, but if you're going to live at home, it does become important because you want those things to be done, especially around flowers and painting and things like that. And so they were mentioning those to us as well. And that feeling of security, and that feeling of security that is not necessarily the police car going in front of your house. But that feeling that you are okay to live at home, that there are people around you to whom you can reach out, and that in fact you are not alone, that you are feeling in security. And so through different research, and you see the years down there, I have my references from 2013 right up to 2024 in different projects, my team and other teams as well. If we look at the literature, the same elements kept coming out as to what services were not being received, and that the accumulation of not being able to access services was becoming sort of a decision point that at one time the older adult would say, this is becoming too much. And if there was something else that would happen and would add to that, they would say, we can no longer remain at home because we are not receiving the services and the supports that we need. Um, we also know, and I have a 1 in 10 here to let you reflect for a few seconds on what that 1 in 10 could be, because this is also a deciding factor in being able to offer nursing home without walls. And that 1 in 10 is that 1 in 10 individuals who are newly admitted to long-term care could have remained at home if the services in the community would have been available to them. That is a huge number if we think about it. And so it's trying to address that one person in 10 who could have remained at home if they knew of the services and if someone could have coordinated those services and to have something available to them in their local community. It's also important to talk about aging in place and the supports of aging at home because of the alternate level of care. And the ALC patients, or the people who get labeled ALC, we know are about 20% of all hospital beds in Canada. That is a huge number, 20%. And also the cost that is related to that. The cost in dollars, but also let's not forget the quality of life of those individuals and those family members who are going through that experience of waiting for a long-term care bed and who could possibly be returning at home if um, the services were there as well, and maybe avoid completely that admission to long-term care if the supports would have been offered in the community. So, nursing home without walls is tempting to address all that. It's a big mandate. So, the thought behind nursing home without walls was to leverage what was already being available in the community. We did not want to reinvent a structure. And so we looked at what was already in the communities and we said, well, there are long term care facilities. What if we offered or gave them additional resources, funding, and human resources as well that would go along this project called Nursing Home Without Walls. And the role of those employees would be to offer services to citizens in that area of the long term care facility, but in the community. And it would address the access to appropriate services and supports, inform people of the services, help them apply, accompany them through the process of applying as well, and also address the isolation and the loneliness through social health initiatives. Also provide them with the information and knowledge that is needed to remain healthy as an older adult as well, and to try to empower the communities to become an age-friendly community. Here in New Brunswick, an age-friendly community, we have a recognition program. I know many provinces in Canada do have a recognition program, and also the Public Health Agency of Canada truly supports communities become age-friendly. And so those were the objectives that we put forward. And what it looks like, I know this is a very busy slide and I will go at it still quite quickly. is that we looked at communities' need through an asset-based community development approach. We truly connected with the local community in which these long-term care facilities were located to really find out what priorities there were, or what the priorities were for those older adults and their families. Because based on the other resources, the assets that are available in the community, from one community to the other, nursing home without walls could look very different. And we wanted to respect that. We wanted it to be very client-centered or person-centered, and we wanted the model to be flexible as well, so that it could offer the services that are needed, and that we wouldn't be going in with sort of a checklist assessment where someone mentions something and we say, "Oh, sorry, it's not available on our list." And that's what we heard as well, that was creating difficulties. And so we very much wanted that flexibility approach, that person-centered approach, but definitely based on the needs of the community. So from one community to the other, Nursing Home Without Walls acts almost as an umbrella term, if I can say, where different programs or different services can go under what is called Nursing Home Without Walls, so that it does respond to the needs of the local community. That can look a bit different, and that's why we have Emma here, who will talk to us in a few minutes about her program here in New Brunswick. But just very quickly, some of what we see as far as nursing home without walls programs is around, very much around the navigation and accompaniment. We quickly realized that this was a huge need in all of New Brunswick, no matter if it's a rural community or urban community, English speaking or French speaking, didn't matter. People needed more than just calling a 211 to get information. A lot of times they didn't even know 211 or didn't realize what 211 was. And that it's more than just that individual sharing of information. It's very much sitting there with individuals or families and informing them of the services that are available based on what they are needing, and going through that process of applying. Also, social health initiatives, as I mentioned, it goes with our objectives, of course, but this looks very different depending on what is present in the community. And we don't necessarily all offer it through Nursing Home Without Walls. It's very much a collaboration with what is already available in the communities as well through different groups. It could look like group activities. It could look like friendly calls and friendly visits, intergenerational activities based on the schools or universities that are in that area. Some caregiver respite as well through, it could be, I know in some communities they call it the buddy program, where a volunteer goes in, spends time with um, the person who needs I don't want to say care, but support, to let the family member have respite for 2 or 3 hours at a time, and using, for example, the community radio to try to have different venues to reach people and to provide them with some social health initiatives. In some communities, older adults can also go into the nursing home to receive personal hygiene care by using the tub in the nursing home, staying for some social time, some social activities, maybe lunch, and going home with a few meals as well. Some community long-term care facilities use their minibus or van for transportation as well. And when this happens, they also have staff that go out to the community as well. So there's a blend of outreach towards the community and having activities in the community and in the home. But there's also some people coming into the long-term care facility as well. And I would say differs from a day program. The objectives are not necessarily the same, although they could look quite similar. And in some programs, it's very much limited to supports and services, including foot care and home maintenance and social activities and whatnot. And my last slide, I believe, before I pass it over to Emma. So we've come to discover that there are some essential or core elements of this program. And as I mentioned when I was explaining the differences in the program, this is working because it is very much person-centered. It directly serves the older adults based on their needs, also their family members. Is very collaborative. We are not there to replace or duplicate. We are there to collaborate and to have sort of that oversight view of what is offered in that local community and for it to be offered to older adults and depending on their needs and whatnot. We oftentimes have that full picture, I guess, of what is out there and also very much flexible, as I was saying, and no cost to older adults as well. This has become a provincial program now through our provincial government through social development and is being offered as we did in the pilot project free of charge to older adults. So to hear more about exactly how it happens on the ground, I would like to pass it over to my colleague Emma, who will tell us more about the Nursing Home Without Walls program that is available at Passamaquoddy. And Emma, you can just tell me to change the slide and I'll be happy to do so.
Thank you. Good afternoon, everybody. I'm really thrilled to be here. I'm actually joined today by our administrator of Passamaquoddy Lodge, Yolande J., who's a huge supporter of the program. So I'm very happy she could be here today as well. So next slide, please. So I'd just firstly like to address our team. When we initially started 19 months ago, there was 2 of us, but we actually have grown significantly. Because we cover such a large area, we felt it was very important to have people in those communities accessible to those seniors so they could access them. And we actually are currently going to be adding another team member to cover another area that we're breaking into. So it's a growing team. Next slide, please. One important thing for us is how people are finding us. I'm very pleased to say that I'm able to add to this slide all the time. It's increasingly coming through self-referrals, our extramural nurses who work out in the community here, social development. We're getting referrals from doctors now. We do maintain our social media and our website, of course, and we do lots of speaking engagements. So we're increasing our visibility all the time, and the word is definitely spreading, and we're getting an increasing amount of referrals. Next slide, please. So we cover the whole of Charlotte County, which does include 4 islands: Grand Manan, Whitehead, Deer Island, and Campobello. And each is unique in terms of how we get there. Campobello, of course, we have to, there's no ferry 6 months of the year for there, so we have to go through Maine, through the international border of the US. So that has created some interesting challenges, which we've had to be clever about, especially with the changes recently. For example, a lot of our clients, actually residents of Campobello didn't have a passport, and with the stricter rules, our wonderful coordinator on Campobello had to arrange for passport photographs for somebody to come down. We did find somebody, but unfortunately they didn't have passports, and so they actually were picked up at the wharf here in St. Andrews, Canada, and driven back to Campobello by the mayor of Campobello. So just to avoid the whole going through the states. So definitely facing unique challenges and having to come up with clever ideas to get around them. Next slide, please. So as Dr. Suzanne Dupuis-Blanchard mentioned, we definitely did a lot of asset-based mapping in our community. We wanted to see what was there to leverage, but also not to duplicate. So I just highlighted a few people here. So the extramural nurses who work out in the community, as I had said, they're also in these clients and seniors' homes, so they're referring us to them. We actually recently partnered with the MBCC electrical program students, and they put up Christmas lights for our seniors in this area. It was a community feel good, but it was infectious, and it just gave those seniors a little bit of they were able to stay in the home and enjoy Christmas. we recently had partnered with UNB St. John, the University of New Brunswick St. John, and we had third-year nursing students join us as part of their preceptorship. And another thing that we have done is we have leveraged the electric car here. So through grants, we've been able to use that car to visit clients. We help Meals on Wheels to go to Grand Manan. And we also had partnered with Extramural in helping their patients get blood to the hospital, as there is no transportation in Charlotte County. Next slide, please. This is just a pie chart to, our main service we offer is system navigation. We also do education as well, but this is just a breakdown of the services that are being utilized the most. So we've helped people with the Canadian Dental Plan. There's a program here in New Brunswick to help seniors pay rent. It's called the Direct to Tenant Benefit. Wellness and social checks, low-income senior benefit, applying for the long-term care program to help seniors age in place by bringing in home care. And as you can see, it's a wide range of system navigation that we have offered, and it's forever growing. Next slide, please. So we are a bit of data nuts at the Charlotte County Seniors Resource Center. We like to see the numbers. But this is broken down into the money that we've helped seniors apply for to help them age in place. So we do other system navigation too, but we just thought it'd be easier just to break down the numbers, and so you can see what we've helped seniors to navigate financially. And the next slide, please. So I'm very proud of this number, and actually it has increased since I did this slide, but so far in the 19 months, we've been able to apply for $586,652.10 for our seniors in this area over the 3 sites. So that's money going back to those seniors to help them age in place. Next slide. One pilot project I would just like to touch on is Grand Manan, one of our islands that we serve here. They didn't have a Meals on Wheels program, or that program no longer existed. So we had negotiated with social development to bring that program to Grand Manan. In New Brunswick, there is a 2 service criteria, which means in order to get meals subsidized through social development, they must have home care. So through a lot of discussions and negotiations, we were able to remove that 2 service criteria and get food to a number of clients on Grand Manan. And our hope is to advocate and to remove that 2 service criteria, because not all seniors need in-home care, but they do. There is food insecurity that we are seeing across Charlotte County for sure. So, and again, we have leveraged that village car share, leveraging everybody that we can to help make these projects work, and proving the need for this project as well, the food, getting the food to Grand Manan. Next slide, please. So I like to finish off on the wins, of course. So on the 7th of December in 2023, we had 7 clients. Currently, as of today, I just checked today, we're at 357 clients. So it's certainly a growth. Certainly we're experiencing a lot of growth. One of the most, the other things that we're proud of is strengthening our relationships and partnerships. We had hosted a seniors expo, so putting all of that information into one spot for seniors to come and visit and interact, which was very important. We have another one planned, even bigger and better. So we also are very proud of the success in assisting clients receive financial assistance and system navigation. And sometimes we've just been a landing pad for people to come and just air their frustration. And then we help them figure out how we can help them system navigate. Our offices, obviously we're there, they can come, and we'll do the best we can to assist them. Or if not, we have a network of people who know how to assist them. So one of our biggest wins was the ability to travel to clients' homes. There's obviously people face financial and mobility issues. So that was a huge win for us, is to be able to travel to them. And the support from the communities. We had done a lot of presentations to, I think it's 5 different municipalities here. So to get, to obviously get their support and let them know what we're doing within their communities has been extremely important. And obviously being here today with you and being able to present and talk about how we're serving rural, remote New Brunswick and continuing to thrive is wonderful. Thank you.
Thanks, Emma. You're a tough act to follow, let me tell you. I feel like what I have to present is far less interesting, but maybe not. Maybe you're curious and engaged now and have heard all of the, good stories of what Nursing Home Without Walls is and what it can do. And I'm telling you now about how Healthcare Excellence Canada played a role in this and where it will be going. So my name is Stephanie Lagosky. I'm a senior program lead at HEC. And if you're not familiar with Healthcare Excellence Canada, we work with partners to spread innovations, build capacity, and also catalyze policy change. And our goal is so that everyone in Canada has safe and high quality healthcare. So we partnered with the Government of New Brunswick as well as Suzanne from the University of Moncton to spread this initiative from 4 pilot sites in New Brunswick to now I think we're around 30, and with commitment and full ownership from the Government of New Brunswick to own this innovation initiative and intentions to spread it to the rest of the nursing homes in the province. So the ways in which HEC played a role is we helped with the application process for nursing homes to indicate their interest in doing this and how we would work together with them to get them up and ready to implement this program, which includes the onboarding piece as well as some program management as well. We also provided capacity building directly to Nursing Home Without Walls sites. So from the 4 pilot sites where this initiated in New Brunswick, we were able to learn quite a bit about how this program works in practice and the general steps that a site would have to take to implement this. So we act as knowledge translators, essentially. We learned all we could about how this innovation works, and we translated that to new sites so that we could accelerate the implementation of this in the province. And so we used webinars, we had coaches coach new sites, we had an online resource hub, and we met yearly in person as well to share knowledge and for sites to share what they're doing, ask questions from one another, and really just connect everybody who has the knowledge on this innovation together. And then lastly, we also assisted with measurement and evaluation. As part of our partnership, we all had different aims of what we wanted to see as a result of the spread and implementation of this program. So we developed a logic model, we developed a agreed upon measurement strategy, and we also worked with sites to implement site level data collection so that when people like Emma were doing an intake of older adults, they were able to ask certain questions and measure certain things at intake, and then in a quarterly basis or yearly basis after that, so that we could demonstrate and examine whether anything has been changing as a result of this program being implemented. And our areas of focus from HEC, primarily at a very high level, were to help delay access or help delay entry to long-term care for older adults who could be cared for sufficiently at home, as well as reducing unnecessary ED visits through more upstream approaches like this model, early detection, and all of the programs that Nursing Home Without Walls provides. Lots of secondary measurements as well that aren't secondary in value, but just kind of the second suite of things we were trying to measure. A huge one is social isolation, whether there's any reduction in that as a result of this program, whether there's an increase in knowledge of healthy aging in the communities that implement this, how it's affected long-term care homes or nursing homes and staff who have participated, and how it's affecting the community as well. So those are the things we help set up. Next slide, please. So going ahead, as we've spent the last 2 years focused on New Brunswick, and rightfully so, moving this from a pilot program to a fully supported sustainable program in that province, it's begun to gain traction across Canada as well. Much like what we're doing today, people have reached out to us and asked us to speak on what we're doing, what this innovation is, and how it could potentially be modified or applied in different provincial settings. So up until quite recently, all we could really do was attend those meetings and share the knowledge that we had. And we created implementation guides to try and distill all of the knowledge that we created from the program in New Brunswick to share with others. But thanks to a generous grant from the Waltons Trust, as well as our continued HEC funding, we are able to set up a pan-Canadian spread of this program now. So what that looks like is we are working with interested jurisdictions and taking an approach to, very similar to New Brunswick, to work with organizations or agencies at a provincial level to set up this program and implement it in their provinces or regions. And this is different from us directly supporting a nursing home or long-term care home site that comes to us and says they want to implement this, because our goal is really from the outset to have governments and agencies and organizations involved in the ownership of this. We're really concerned with sustainability. So from the outset, we were looking for that buy-in from provinces and territories to set up this program and see how it works in their regions. And then they would then fund individual nursing home or long-term care sites to become nursing home without walls sites. And we would work with them in the exact same way we worked with New Brunswick. So it would be provincial ownership in a way that makes sense for that province based on what already exists and how they're doing things, with an outlook for sustainability. And the benefit of that is also being a part of a larger pan-Canadian spread. So instead of just working sort of in one-off ways, we're hoping to harness this collective desire for the implementation of this program within a community of practice. So provinces who are doing this will learn alongside each other. We'll be gathering folks together, and they'll be sharing their knowledge on what's working in their province, the ways that they're approaching this, what they're measuring and how they're seeing the impact, so that we can make this a larger national movement, as opposed to it being something that's just being implemented in silos across the country. So that is our current approach. Next slide, please. So what's next? Specifically in Ontario, as that's the context that you're within, we are working with a number of folks at the provincial level to try and build the model of what this would look like in Ontario. So we have a few jurisdictional leads in mind who we've been working with over the past year. We're talking with the ministry to see if this program is of interest to them and how it aligns with their current goals and strategies. And we are basically just tracking the interest also at a site level, so that when jurisdictional leads are up and running, they are aware of different homes that might be ready to put their hands up and say, hey, we would like to maybe be a pilot site for this where we are. So all of that work is happening over the summer. And in the meantime, we do have our implementation guides, which can be found on HEC's website. If of interest to you, I would encourage you to browse those. They contain basically a step-by-step guide of what you would need to know to implement this. So you can get a sense of what's involved in doing this type of work for this program. And at the end of the summer, our evaluations will be completed, and we'll start to disseminate the formal results of both our program evaluation as well as an economic evaluation, which we conducted as well. So we're sort of in the midst of conversations and agreements and working it out at a higher systemic level. And then as those are firmed up, then as this year progresses, it will be more clear to individual homes what the root and mechanism of involvement might be. And I see a question that's come in, and then there was a question from before. So maybe I'll just pause on answering those because they might be part of a larger Q&A area. So thank you.